All right, part 2 of to FDL or not to FDL. So if you go back to that patient that I showed a couple of days ago, I think it was 3 days ago, you will see that we got away without doing an FDL because we were able to remove tissue in a circumferential manner and disperse that abdominal tissue better, so there wasn't any laxity. Now, does this work 100% of the times? No, it may not. And in those cases, we may need to do, again, a reverse tummy tuck or potentially an FDL in the future. But a lot of my patients, again, don't want that vertical incision. And, once you do that incision, you're obligated to it. I've put FDLs on. Other doctors have put FDLs on. The ones that you're going to see on Instagram, let's be honest, they're all going to be great results. And that vertical scar doesn't always heal well. It can sometimes be a little hypertrophic. Any scars that are in the midline, unfortunately, sometimes have that tendency. And we can't always predict who that's going to happen to. So a lot of my younger patients don't always want that scar. So if we obviously know you need an FDL, you need an FDL. And most doctors can tell you that. But if you're sort of that gray area where you have some laxity, but it's not significant, in that vertical vector, you may be able to get away with a lower body lift. And if that doesn't work completely, a reverse tummy tuck in the future to get you that result that you want without a vertical incision. Now, again, some people need it. There's no getting around it. Or you have to accept some laxity in the upper abdomen or when you lean forward. And that's a choice. And some patients would rather have a little bit of loose skin rather than a vertical scar. And that's totally acceptable. And that's where having an experienced doctor who does a lot of after weight loss, obviously a board certified plastic surgeon, can give you those, pros and cons and come to the best decision for you to get you the results that you want. Because it's really going to depend on your goals and expectations. There are some patients that just don't want that scar. Other patients that's completely acceptable to. And some patients would rather take a chance and not do the vertical incision right away because maybe they'll be happy without it. Or maybe they can be improved, like I said, with a reverse tummy tuck. So there are a lot of options. You want to find someone who, again, is going to talk you through all these options so you can make the best decision for you. Because in the end, you're the one who has to be happy. You're the one who has to look in the mirror. You're the one who's got to love yourself after all this. It's not my opinion. It's not the opinion of others. So you just want to get all the information and make the best decision for yourself.